So my next question, and kind of a bit of a statement as well, is that at the Patient Information Forum, our mission is to help people like you to provide accessible health information for patients and the public and other healthcare providers. So last year we created a set of standards for health information called the Individual PIF TICK. You very kindly took part in the pilot of that and tried to be one of the first to earn the Trusted Information Creator logo to put on your content. Firstly, I wanted to kind of take this moment to thank you for being part of that and for the feedback that you gave that helped shape the Individual PIF TICK and the way that we're going to assess and support future health information creators. I also wanted to let everybody know that as well as being part of the pilot, you've now joined the PIF TICK team to help other people that create health information and content creators with their information and their processes. So my next question is, when it comes to how you create health information, how do the individual PIF TICK assessments help you with the creation process that you go through? And what were the kind of key learning points that you took away from the assessment or the support or anything that you did with the PIF team?
Yeah, thank you. It was great to take part in the pilot because I think when I first looked at it, I thought, okay, this is very detailed and I have to put quite a lot of information into this. And I think the process was all in my head. So I knew what to do and how to do it, but I hadn't had it written down. And so I think the individual PIF TICK kind of assessment got me to actually put that down, put pen to paper, and really kind of refine my process. So I've been using my process, and now that I have a few successful videos, it's so helpful to go back and see that documented and see what worked. So then I can actually repeat that process again for more videos in future, which means that I can have even more impact in future with future videos. So it kind of builds upon my confidence. And I found the resources really helpful as well. So the how-to guides from the website that I can just download, and also the summary posters are really great. They're really colorful and they're really like straight to the point. So you can just grab the key points and then kind of integrate that into my script or my video. And I think as a healthcare professional, you have a lot of technical knowledge, and you really do need to take that time to digest it to make sure that it's digestible. And PIF provides these frameworks and guides to like help me do that. So it's so useful to have that knowledge now. And you think you're doing something right, but then when you go and read a guide, you can see, oh, that kind of language has changed. And I think as a writer, you kind of take for granted how much language changes over time. So you do have to constantly keep it up to date. And it gives me great confidence that PIF takes the time and energy to update their guides. And, you know, they stand by their own standards as well. And I think as a creator, you can feel really isolated. And when you know that a lot of people are using the same resources, it becomes more of a community of health information creators and more of a collaboration, like you said, with the charities. And charities really focus on kind of long-term health conditions. And I think as an individual, you can really kind of focus on acute health conditions as well, because I know that fellow creators like Dr. Asmine and Dr. Sophie, they create things for their patients, or medical quizzes with Dr. Asmine. And Dr. Sophie creates things for her patients to kind of help with the running of her GP practice. So I think that's one of the highlights of being part of a forum, is that you get to ask each other questions about what they're doing and what's working for them. So what they've tried, what they've had success with. So you're not always asking from, asking or starting from scratch. And I spend a lot more time planning what to create, which makes it much easier when it comes to writing or filming. So it's really helped me streamline my process. And I think overall, it helps me create higher quality content. So I get more views, which means I have a bigger impact. But then ultimately, it means that I'm helping people, and those people could be patients. And that's the ultimate goal. I think we're all working towards the same goal ultimately. And it's great to have that confidence again, to know that someone has looked over my process and I'm creating health information that's in line with standards that have been developed over the years, and that they are constantly evolving and being kept up to date. And these are standards which have, again, been acknowledged by the WHO and the Academy of Medical Royal Colleges and the NHS, and also YouTube Health recently. So it was great to be part of the YouTube Health features launch. And they said, if you want to appear on the health shelf, which would be at the top of search results for health information, then you need to meet these kind of standards anyway. So having PIF kind of independently look at my process and tell me I'm on the right track is really, really great. And it's also a great way to show my audience that they can trust me as a health content creator, because I'll be able to use a badge, hopefully, which says trusted information creator. And it's kind of like a stamp of approval, but you just don't see that on health information right now. You don't know what to trust because there is so much information, and WHO called it the infodemic, which I know PIF was involved in that report as well. And we need to keep that in mind, that people are feeling overwhelmed with information and they need to know somewhere that they can go to, or a creator that has that kind of accreditation. And it will also encourage me to review my content as well to make sure that it's up to date. And I now put, published and then date to review on my videos that follow my PIF tick process. And yeah, I think it's an ongoing process to create health information. You're constantly trying to improve what you do. And I think when people watch me create content, it's an opportunity to empower other health professionals to create health content too. And I really believe the more of us there are, the better, and we'll have a bigger impact. And I think people also love it when they see creators collaborate with each other, because you do kind of have this, what they call a parasocial relationship with the people that you watch, and you develop that trust the more you watch them. And so it is a privilege, and you want to make sure that you are doing it right. And this includes working with charities and health organizations as well. So we also know we're on the same page when we're creating content. So if they also follow the PIF tick standards, or they know of PIF and they follow their guides, then you know that you're going to produce high quality health content together, which leads to a greater chance of success, and a bigger impact will be the result of the health campaigns that we want to run. So we'll actually reach the people that we are looking to support or help with their health.
Thank you. I just got two bits that you kind of mentioned there that I just wanted to pick up with you. You said at the beginning, it felt like there was quite a lot in there and you had to kind of understand what was going on and kind of look at it. And then the actual assessment itself, sort of just that terminology, you're going to be assessed by somebody, can feel quite intimidating or quite scary. I just wanted to know what your thoughts were once you kind of dug into it, around the assessment itself and, the layout of the way that you go through those assessments.
Yeah, I think the way that the assessment was carried out was actually really straightforward. So it's broken down into 10 sections, and if you go through all of them before you actually start filling it in, you realize that it's actually really simple. So I kind of saw section 1 as like the overall process, and I thought, okay, this seems like the most detailed bit, but all of the other bits are much smaller and easier to complete. So let me do those first. And then I went back to section 1, and then it was so much easier to kind of complete that. And then when I had my one-to-one assessment with you, Dan, it went really smoothly because I had taken the time and care and attention to fill out each section to the best of my knowledge. And I'd like to say that I passed, but I'm still waiting for my results and my report. And I got green on most of the sections, which is great. And I think it was a much easier process than I think people think. And it's really important to, just sit down and get it done. And I think it took me like half a day, probably like 5 hours or something like that, which is not too long for something that I'm going to use over and over and over again. and clearly works because I've gone out and create those videos, got the views, and got the thank you comments from people on the video, which is always really nice when they take the time to not only watch the video but also say, hey, this was really nice, thank you for creating it. And I think that's what makes it really worth it, when you get that, qualitative and quantitative feedback. And yeah, the assessment process was much easier than I thought it was going to be, and I think it was definitely worth it, and I would do it again, and I actually look forward to my next one. So, because it will be even easier. The first one's always the hardest, but then the next one, if you're following your process and you're seeing that it works and it's been signed off, then your next one's just going to be easier, and it just gives you that confidence. You'll just have to tweak it a little bit. And I'm already tweaking my process to try and make it easier for myself, or to include an extra layer of accessibility, that kind of thing. So it's great to see it as a collaboration rather than someone judging you for what you're doing.
Yeah.
And I think it's not an assessment in the same sense that you need to pass your driving test. They're going to judge you on every turn or every time you stop at a traffic light. So yeah, it's much easier than you think, and it's a collaboration. Right. And ultimately, getting someone to look at what you do should give you more confidence, not make you scared. So just go for it.
Lovely, thank you. Yeah, I mean, we designed the PIF tick scheme, not the individual one, many years ago, to be that supportive kind of scheme. That the whole idea is to get you to create great quality information and support you to be able to do that. And it sounds like, from the feedback that you've just given, that's what we're doing with the individual PIF tick as well. So that's really good. So I'd like to thank you for your really insightful feedback, and for sharing how you create high quality evidence-based information. You mentioned a minute ago that you didn't know the outcome of your assessments and stuff. So I would like to present you with your certificate and let you know that you have passed your assessment, your pilot assessment, and you are now formally part of the PIF individual scheme. So well done, and congratulations on all of the hard work that you've put in to receive this certificate.
Yay, thank you so much. It's so great. I'm so excited, and it will be so nice to put my first logo on one of my first videos from the 1st of February. So I'm really excited for that, because I spend a lot of time researching and planning everything that I create to make sure that it's up to scratch, and then now I can actually put the logo on it, so people will see that too, and then also raise questions about the other things that they watch as well. So I think it's a good thing. Yeah, thank you so much.
No, that's you're more than welcome to it. You've definitely earned that with the hard work that you put through. Just to also let you know that you will also be listed on our PIF TICK individual content creators directory, with links to your social media channels and websites or anything else that you get involved with. We update, and this gets shared with GPs and healthcare professionals twice a year. It's also downloadable throughout the year from our website. So just wanted to let you know that it's not just that certificate. We do help to promote all of the hard work and the good videos that you create. So from me, I would just like to thank you for your time today, Pharmacist Virginia. That was really great. So thank you very much.
Thank you so much.
If anybody else would like to learn more about the individual PIF tick and how you can earn your own Trusted Information Creator Certificate, you can go to our website at pifonline.org.uk, and we will leave a link at the bottom of the video for you. Thank you very much for watching.
Thank you. Bye.